on our first of many statewide webinar series. Today we have Jesse Lisson with HealthiestYou. He has been with the company for a little over a year. He's the manager of partner development, and he's going to speak a little bit to the newest telehealth program that is included in each and every one of our group's UHC All Savers health plans. And the goal with and HealthiestYou's goal is to drive claims away from the medical plan, or unnecessary claims away from the health plan. So he's got a lot of really good information. This product can be a standalone as well, so it does not. It's not just only in UHC health plans, but can be of use for other groups as well. So with that, I will kick it over to Jesse and let him speak to the program and how it could be of benefit to our groups.
All right, thanks so much, Patrick, and thanks everyone very much for joining this morning. I know it's a kind of busy start to the year for everybody, and I'm really excited to share HealthiestYou with everyone. So what we're going to cover today is, of course, we are, as Patrick said, we're included in the All Savers health plan, so we're going to touch on what that means to you, what that means to your client. Also going to touch on how we fit into also on a standalone basis, so say fully insured plans or those self-funded plans out there in the world. We'll dig into the doctor network. We'll touch a little bit on wellness, and I want to really focus on some of our technology that we'll have releasing here within the next week to 3 weeks. We've got some really, really good stuff on the way. So first thing is, as Patrick had mentioned, our goal is to take any claim that could be handled over the phone and get it to us rather than have it hit the claims. If you think about acute illnesses, a lot of other things, it can actually now be safely and effectively handled over the phone. So our goal is to take that claim away from the medical plan. So what that means to All Savers clients is anytime they call us first, rather than go see a doctor in person, it's going to save the company money, it's going to save the employee money, it's going to keep the employee at work, and care will be delivered much more efficiently, a lot faster. So really it's just there to help. And again, HealthiestYou is completely free. It's included with the All Savers health plan. So there is no cost to the employee. We don't charge consultation fees. It's an important part. And no cost to the employer group either. So that the biggest thing I can say is as far as communication with the All Savers plan, we want them to think of us as being a front line of defense where if it's not an emergency, call HealthiestYou. If we can handle it, which is 6% of the time, then go ahead and access the major medical plan. But that definitely is our goal. So what we focus on and why, for example, UnitedHealthcare wanted us with the All Savers health plan is our specialty really is member engagement. Telehealth has been around for a while. I'm not sure if anybody on the call has sold anything like this in the past, but typically it had a really, really low utilization number, generally about 2%. So it didn't have much of an impact on claims, more of a, I'd say, a checkbox style benefit. And that's where we said, you know what, this product can have an enormous impact on a plan, right, as far as claim reduction or helping with like it's an HDHP style of plan, but you've got to get people using it, because if not, there really isn't a value there. So our goal again is engagement, and I'm going to touch on that a lot today, is how we are engaging members to get them to use it, which creates value, which, you know, again, All Savers plans can help them tremendously, along with you know, a lot of your other clients potentially as well. So big reason for telehealth is this. Over 70% of all emergency room, urgent care, and office visits can actually be safely and effectively handled right over the phone. And you roll that into the top 9 reasons we visit an emergency room in the U.S., the striking thing about this slide is they're all acute illnesses. So you look at your allergies, bronchitis, pink eye, urinary tract infection, strep throat, right? All these things that we can more or less self-diagnose, that's the reasons people are going to the emergency room. So you think about an All Savers plan. If I'm going to the ER, it's going to cost me and the company quite a bit of money, right? Where I can call HealthiestYou, it's $0. The only thing that would cost is the antibiotic. So I'm probably looking at a $4 to $8 check or, you know, bill for an antibiotic. That's it, rather than over $100 to go into an emergency room. So that's the power of, you know, keeping that claim out of the health plan. And I'm sorry I didn't mention this earlier. If anybody has questions, we will field questions at the end, either through the chat box or we're going to open it up for discussion through the phone line there. So please hold on to your questions, or else just go ahead and send them to that chat box, and I'll be happy to answer those for you. So a little bit about our physician network. Right now we have about 1,700 physicians available in 48 states. There are 2 states that HealthiestYou isn't available, and that would be telehealth as a whole. That's Idaho and Arkansas. The physicians themselves are all licensed and reside here in the U.S. They're all board certified. They're available by phone, they're available by video, or they can be sent an email. Our physicians can diagnose, treat, and prescribe. So what's real powerful here is you're not connecting folks with, say, like a nurse or a nurse practitioner. These are physicians, and they can, if needed, they can prescribe medication. About 60% of our calls result in a prescription. You know, a lot of times, obviously, we're going to be dealing with viruses or something where an antibiotic won't help, but it may be something else like we've gotten over the counter. So they're there to help out. But again, we can handle a large majority of things over the phone. And we do have the largest telehealth network in the country. So that 1,600 physician network is the largest one available. So this is an example of the member experience. Very straightforward. So we have a couple of unique things we can do now. You can call an 800 number. Essentially, that's a first come, first serve. You can schedule an appointment online, or you can schedule an appointment through our smartphone app, which will release next month. Most commonly, people just call. They do a first come, first serve. But you can develop a rapport with the physician licensed in your state. So if you do that and you want to wait for that physician, you have that option as well. So once we either take the phone call, right, or we get that appointment scheduled, you'll provide your medical history, and then a call is scheduled with the physician licensed in your state. So let's say I'm here in Arizona. If I call from Arizona, they verify that I'm here, and then a doctor licensed in Arizona calls back to provide a consultation. So that doctor reviews basically my electronic medical record, right, my online patient history, calls me. We go through a consultation, which on average lasts about 13 minutes. If a prescription is required, doctor sends it via e-script to the member's choice of pharmacy. So I've got a pharmacy down the street from my house. That's my preferred pharmacy. Doctor sends it there. If I'm traveling, that prescription can be sent to any pharmacy, right? So this benefit will travel with you. A doctor then will update the electronic medical record with our consultation notes. We will share those notes with the member's primary care physician if they'd like us to do that. We're absolutely happy to do that. And with our new technology, we're going to have some pretty unique content where, let's say I'm diagnosed with an allergy. My smartphone app will get sent a video recorded by Dr. Kelly Traver. She's our chief medical officer. She designed our wellness platform, and it will be specific to whatever I was diagnosed with. So if it's an allergy, there will be a 1.5 minute, high definition video presented by Dr. Kelly about what an allergy is, how to control symptoms, what to look for, and so on. So we're going to have a nice roundabout way there for healthcare. So using technology, so I mentioned engagement. What we are all about is getting people to use it. So again, the typical utilization in the industry is about 2%. That was the average. What we've done before any of our technology is we've actually boosted that number. Our average utilization, annual basis, is 40%. So again, what that means is we are getting people to use it, plain and simple. Now, we're going to step up our game a little bit. So we're about to release what we think will be a game-changing smartphone app. And we say that because now we have what's called GEO-FENCING. So we've taken every location of every doctor office, urgent care, emergency room, and pharmacy in the country. So when you're a member of HealthiestYou, you've got our smartphone app, and you walk into, say, an urgent care for care, right? You forget you had HealthiestYou for whatever reason. Once you're there for 2 minutes, your smartphone app pings you, reminds you that you have access to HealthiestYou, includes 24/7 access to doctors, no consultation fee, no copays, right? So basically you can call now, doesn't cost you anything, much faster. You touch connect with the doctor and you're off to the races. So what we're trying to do with this is it's a couple of things, right? Of course, we'd love to say someone went to the urgent care, they got a push notification, they called us, we avoided a claim. That may happen, they may stay there, but we're going to help to change behavior. So even if they don't leave that time, next time they're sick, they're going to think about HealthiestYou, right? So again, we're all about engagement. And this is the same, this is available to anybody that has HealthiestYou. So those folks on All Savers, we're going to push a heavy marketing of the app once this releases. But the important thing to note again is it's just all about engagement. We're going to keep HealthiestYou top of mind, catch people at their time of need. And like anything, it's a push notification. So once, let's say, obviously I work for HealthiestYou. I don't really need a push notification. I'm going to use it for a while just to see how it works, and I can't wait to see it. But eventually you can turn that off, right? You go into your phone settings and turn that off. And this is available for Android devices as well as iOS devices. So you'll have the iPhones and the Samsungs and so on. But again, the big one is we're going to catch folks at their time of need, which is going to be a lot of fun. Pharmacy side, same idea. But we have a prescription drug engine available, and members can basically shop for the lowest cash price on prescriptions in their area. All right. So what it's pulling is every pharmacy benefit manager contracted rates, so those PBMs. So basically, we're pulling discount cards. We're also pulling any in-house pharmacy sale. And what we found is with our engine, this will actually be at an average copay 7 out of 10 times. So this is available through our member portal, but also it's going to be in our smartphone app. And we'll use that same GEO-FENCING technology. So when you walk into a pharmacy, you'll get a push notification reminding you, to shop around. We may find you a much lower rate than the pharmacy you're walking into, and we see that happen quite a bit. And all we do then is we take the phone. Let's say you find a lower price at a pharmacy in your area. You just clip a coupon to the front of your smartphone app, show the pharmacist that when you arrive, and that's the cash price you pay. So real straightforward. Again, we're going to catch people at their time of need. The other nice thing about this is we're going to keep a claim out of the medical plan. So for those All Savers folks that we're going to maybe use their card to pay for a prescription, they might find a much lower price here, and we'll have them use our prescription drug engine instead. They pay cash, keeps the claim away from the plan. Some survey results. The biggest one here is people absolutely love it. 97% of our members will use the service again. All right, that's versus actually it's a 68% satisfaction rating in an in-office visit. So the big one is if we can get somebody to use it the first time, just one time, they're very likely to use it again, and that is why the engagement strategy is so important. That's why United Healthcare chose us for the All Savers plan, and that's how we're saving a lot of our clients a lot of money. On the self-funded side is we're getting people to use it. 94% of members have their issue resolved on one call, so we call it one-call resolution. So 6% of the time, they may have to call back, or we'll refer them, because people do call for things we can't take care of, right? So we will refer them to an urgent care or an emergency room if maybe they had hit their head or they got a bad cut, whatever it might be. But the big one is large majority are handled over the phone with one phone call. And 97% of our members will recommend HealthiestYou. So it's a really nice stat. And the reason I say that is clients that are already on the books with us from year to year to year, their utilization always climbs. The biggest part of that is word of mouth, right? Somebody uses it, they say, wow, I cannot believe how easy that was. This is awesome. They're going to tell their coworkers. Coworker uses it the next time they're sick or a child's sick and so on. And client retention is big. So the fact that people use it, well, it helps in a lot of different ways. It helps you, right, the broker. You're going to look great because you're providing a benefit that people love and people use. It helps us, right? 95% retention means once the client comes over, they very rarely leave, right? So it's just a win-win there as far as we're going to support you. We're going to help you keep those clients on the books. And an important thing to note, and it's not in the slideshow, once a client's here, like All Savers, for example, we have account managers in place. They are assigned accounts. Their job is to keep in touch with the group administrator, help them market HealthiestYou. So, maybe these employees are on trucks a lot, and email marketing helps. It's not so great. They don't like computers. Maybe we need magnets. Maybe we need coffee mugs. Maybe we need flyers. Whatever we can do to keep the communication flowing to the employees, making sure they're using it, that is our goal. We play a supporting role, just like I do as far as selling HealthiestYou on a standalone basis or helping you if you're selling an All Savers plan. We don't sell anything directly, so please keep us in mind. Our job is to help. So another unique feature of our app, what if telehealth cannot handle it? Does the app have some other features? Absolutely it does. So when a person first downloads our app or they first go into our member portal, we're going to ask for their health plan information. Not in major detail, just the plan number. We sent out a press release not long ago, but we're using PocketDoc, their technology, to pull plan information from the carriers. So let's say I'm on an All Savers plan, okay? I'm going to enter in my plan number. Now my app knows my network of physicians, my copays, my deductibles, and so on. So let's say I call HealthiestYou, and it's something that cannot be handled over the phone, so it's going to hit that 30% of the reason I visit. I need to go see my primary care physician or an ENT, like ear, nose, throat. I can actually now search for physicians that are in my medical network right through my smartphone, and I can book appointments there as well. You can do that for primary care. You can do that for ear, nose, throat, dentist, or an eye doctor. All right. Now, why do we do that? Again, it's all about engagement. So even if someone needs to access a doctor in office, they're going to think of HealthiestYou. We're going to stay top of mind. That is our goal. So we've got a lot of unique features in our smartphone app that will go around that. We discussed the pharmacies. So this is really how it looks. I'll shop for a prescription. I'll be provided locations in my area with the lowest prices. I touch the scissors, paste it to the front of my app, go to the pharmacy. That's the cash price I can pay. And again, the big one is beat the copay 7 out of 10 times. So we're going to market that a lot. We want people to use that engine. It helps with engagement, also helps them save money, saves the company money too. One other kind of unique feature we have is what's called second opinion. So this is being built out, probably available first quarter, but I just want to make sure you're all aware of what it is. Let's say I go to the doctor, I get an opinion from my primary care physician to do this, but I'm kind of wondering, right? I'm like, well, I don't know. I can actually scan all my documents, send them to what's called our second opinion team, and they'll look at those documents and then provide, what their course of action would have been. This is optional. There's an additional cost for that, but where I think of it is some of the bigger stuff. Maybe I'm told I'm older and I'm told I need a hip replacement. I really just want to make sure that's the right course of action. I jump in here, scan my documents. It's sent to, usually it's a team of doctors or maybe a specialist in that area. Take a look at my documents. They provide me with their course of action. And then they can also help me to connect with a doctor in my area, someone that could provide that service. So maybe it's a different type of hip replacement, right? More the non-invasive side. That's just an example, but you get the idea. Much easier way to get a second opinion rather than having to pay more claims, right? Pay more copays, go to see additional physicians and so on. So much more efficient. Again, now our goal as we're coming through all this, as you probably saw, is you can access healthcare in so many different ways now through technology, right? Through the computer, iPad, smartphone, and so on. And that is our goal going forward, is we're just going to keep up with technology. It's going to be a major player, how we're going to keep folks connected with HealthiestYou in a big way. You saw this slide. We've already touched on this, but now the important thing to note about our utilization percentage is we were 20 times higher before, and we're about to unveil a new member portal, our new smartphone app. So we think this number is going to jump up tremendously. Who knows where it's going to go? We hope to see it go very, very high. It just creates more of that value, right? It justifies us being with All Savers, being on a standalone basis too. So you all, in case you haven't seen this, we send out fulfillment to every member. So in the All Savers plan, first thing that each employee will get at elected All Savers is an email. It says what HealthiestYou is. It's a high-level overview, how to use it, and so on. Really, really straightforward. Then within a month, they're going to receive a fulfillment kit. So we're going to hit them once electronically. We're going to get them again with the fulfillment kit. Really nice kit, one-page flyer highlighting the service. They get a member card. Now, what's really, really important, I can't stress this enough, you don't need a member card. You don't have a member number to use HealthiestYou, all right? So we get the question a lot. What if I need it on the day it becomes effective? What do? You call the 800 number. Very, very simple. You call the 800 number, get connected with their customer care line. They ask for your last name, your birth date, and your zip code. That verifies that you're a member, and then they're going to go through that, the same questions and connect you with the doctor. But the real important thing is this here serves as a reminder that you have the benefit. It is not needed to use the service, and I can't stress that enough. But we understand people want something in their hand, right? They like to have a card in their hand, something that can be used. And also through our new member portal, you can actually print off a member card, say for spouse independence, right, if they're on the All Savers plan. So moral of the story again is you don't need the number. This is just randomly generated. It's just there's a reminder to use the service. That's all it is. It's part of our engagement strategy. So one thing we love is marketing. So again, we're going to work with your group administrators. These are some examples of our marketing processes. The big one is, we can do anything. We have a lot of really unique marketing flyers available, different pieces that we can use. So as we're connecting with group administrators, or you want to connect with new clients, let me know what you need, and I'll send you some awesome options that'll be a nice eye opener. They're eye-grabbing, something that'll get somebody's attention, and start a conversation for you, be it a new client or an existing client. So I mentioned our utilization team. One thing that we're doing differently than anybody else is our groups will have instant access to utilization. Now, due to HIPAA compliance, it will depend. If you're a group that is 25 employees or under, we can provide that on an annual basis. That's again due to HIPAA compliance. If you're 26 and over, that's employee lives, we will have utilization monitoring available to you instantly. So you log into an admin portal, you can see everything about your group, total number of consults, average callback time, how many people didn't have to miss work, right? Just all these different measurements so that you understand the value, right, that HealthiestYou has created for you. So your All Savers clients will have access to this, and if you ever do anything on a standalone basis, same idea. But we are very, very transparent, and I think you'll find, I don't know if you ever worked again with any other telehealth provider, generally you're waiting on this for quite a while, and sometimes you just don't get it, they don't provide it. Where we want to be transparent because we think it's unique in that if a group is lagging behind, we'll know we need to change the marketing strategy, right? Or we need to drive some other marketing pieces that way. So it helps on both sides. An employer group can say, all right, maybe I need to do a better job of communicating, but we'll know as well. So we can work with them to help them play that supporting role. So we're really, really excited about that. And that rolls out with our new member portal, which should be out within about a week's time. So some case studies. So these are important. Now, this is a self-funded study, so it's a little different than the All Savers plan, but I think it's important because you'll understand that engagement is a really, really large piece of what we do. So this group actually had a competitor, which would be our prior year. They had a competitor for 2 years before bringing in HealthiestYou. Now, they've been with us for about a year and a half now. This was their first year results. What ended up happening, the big ones are this. Number of claimants dropped over 36%. Number of claims dropped 39%. The number of claims paid dropped 37%. So they ended up saving over $30,000, nearly $31,000 compared to the previous year. And now this was while this company was growing. They grew, I think they had an increase in employees on the medical plan of 22%. And reduced absenteeism is huge. So one thing you'll note with HealthiestYou, and I didn't mention this before, 50% of our consultations result in someone not having to leave work for care. That's very, very powerful. When you look at an hourly rate, you take that number, times it by 3, that's what it truly costs when someone isn't there. It's their productivity number. So if somebody's making $20 an hour, if they miss work for 8 hours, actually it's costing the company $60 an hour. It's an enormous number. So we can keep people there half the time that would have traditionally had to miss a day for maybe a sick child, or they couldn't get to their doctor, right? They got to wait a couple of days. It's only going to get harder to get to a primary care physician. We all know there's a physician shortage here. That is going to play a huge role. I think these numbers are going to get bigger and bigger. So with this group, 2.2 fewer PTO days per employee. That is an enormous impact on the group's bottom line, right? So your clients are going to love that. That's going to be a huge selling point. And then this is another one, a larger client, but you get the same idea. This is 2,200 lives. This is a self-funded client. But what they did was essentially saw $214,000 in savings thanks to telehealth consults. So that's claim redirection, right, from the plan to HealthiestYou. Their utilization was a little higher than our average, 44.4%. And they also saved money on the plan design. And I'm going to tell you how that works here in a second. Essentially, they took their old plan, right, $25 PCP, $50 urgent care, $100 after deductible, and an ER. They bumped them up a little bit. Now, what does that do? When you think about an All Savers client, right? I have HealthiestYou through All Savers, which costs me nothing. Or I can go see a doctor for X. Let's just say it's a $40 copay. Well, now I'm starting to think, what do employees care about more than anything else? What is coming out of their pocket? Most folks won't hit their deductible, right, unless something bad happens. So now we want to help change that behavior. So I have access to a doctor for $0, or I can jump on HealthiestYou, right, and speak with the doctor for free. Well, I'm going to definitely call now. I have no risk. There's no risk to do that. So we're going to help drive behavior. The reason I mention that is for fully insured plans, that's the big one. So you start with HealthiestYou. We now know that HealthiestYou can handle 70% needs, right, over the phone. Major Medical is going to handle 30. So you stick HealthiestYou at the front of the plan, similar to what we're doing with the All Savers plan. We want to be the front line of defense, right? Now that we have HealthiestYou there, doctors are now waiting on patients rather than the other way around. Major Medical doesn't need to be so rich. Now that we know that Major Medical is going to handle 30% of needs, right? Deductibles are going to be harder to hit and harder to hit. They're only going to go up. We can trim that back. We can raise some copays, raise the deductible, save money on the premium side. So now you have a fully insured client. You're going into renewal. They're looking at, just for example, a 20% increase in premiums. You start with HealthiestYou. You redesign the Major Medical plan. You make it more flexible. You've just saved that employer a tremendous amount of money on their rates. You can usually run them flat to the previous year using the savings from that renewal to more than pay for HealthiestYou. And then you, the broker, can add in other products depending on what may fit. And you're the experts there. So it could be a gap plan. It could be critical care. It could be accident. You know where to go with that one. But now what's just happened is you have some really happy employees. Their health plan's cheaper. Okay. Doctors are waiting on them. They love that. You have a really happy employer. They've just saved a tremendous amount of money where they were looking at a huge rate increase and thinking, how am I going to do this, right? I don't have money to pay for that. Well, now you've saved them a lot of money while keeping their employees happy, and you've just retained the client, right? So if it's a new prospect, you have a huge differentiator here. If it's a current client for you, well, you've just earned their trust and then some, right? You're going to keep them for years because they understand that, you have their best interest in mind. That's the biggest way I can look at it. So moral of the story here, very rare win-win-win in our industry where you can maybe make a little more commission based on what you sell, and you have happy clients, you have happy employees, and so on. So it's all the way through. And again, we match with, so we are in the All Savers plan, which is an awesome fit. There's no doubt about it. We're a good match for any of these things, right? So your fully insured plans, your self-funded, your ACA plans, MEC plans, limited med, you get the idea. There really isn't a group that HealthiestYou can't help. So on top of All Savers, many, many other ways to use HealthiestYou to your advantage. Now I want to touch on this. Again, All Savers, HealthiestYou were just included. These are our standalone rates. So in the blue circle, right, these are employer-paid rates, and this actually has 15% commission built in. So if you ever sell us on a standalone basis, there's 15% commission built into these rates. What's really important is this is a per employee per month rate. So let's just say we have a group that's 50 lives. It'd be $9 per employee per month. That includes the employee plus their family, unlimited use. All right, that's a really important thing. And no consultation fees. One thing we all know is that if we're going to call a doctor and I'm going to be charged $40, I'm not going to call a doctor. It's pretty simple. We do not want the barrier there, so we don't charge consultation fees. People call, it doesn't cost them anything at their time of need. They call as many times as they want to. We want them to use the heck out of it, right? That's our goal. So these rates are in place as long as utilization doesn't get crazy, which we of course hope it does. That means we're doing our job. But what we do is we guarantee the rates for a year, and then we'll look at the overall, basically our overall block of business in that area, and possibly have to raise rates the next year. But we're going to take a look. We want to keep these here as long as we can. So again, All Savers clients, completely free, right? It's included in the plan. On a standalone basis, these are the rates. And I'll send, I think Patrick will pass along all the information to everybody, but you'll have all this info whenever you need it. And the other thing is, we want everybody to use HealthiestYou. There isn't a better selling tool out there than using it yourself, right? So what we offer to all of our broker partners is a 30% discount for HealthiestYou. And what I'd love for you to do is I'll send everybody an invite to our partner portal, which I won't touch on today because I don't want to take up too much of your time. The moral of that story is you can create proposals, you can create ROI documents, you can send out prospecting emails, a lot of really unique and useful marketing tools at your disposal completely free. Through the portal, you can become contracted with us. You can also purchase HealthiestYou there. So I'll send everybody information, and then you can definitely follow up with me if you have any questions or need anything from there. And I will be your main point of contact. So I just want to throw up on my screen here. This is my contact information. And then let's open up. Let's see how many we've got. I'm going to open up the phone line. So if you all have any questions, I'm going to open it up now. If we get some weird, crazy feedback and it's hard to hear, I'm going to shut it down and we'll use the chat box. But I'm going to go ahead and unmute everybody now, and I would love to answer any questions that you have for me. All right. Let's see. All right, I'm going to unmute as we go here. Sorry if you were talking, the unmuting didn't go great. So the chat box in the lower right-hand corner is available. If you have any questions, go ahead and click on the chat box and send that our way. And if not, I'll hang on the line here, and I'd love to answer any questions that you all have. Or just jot down my phone number, my email address. Keep that handy, and definitely connect with me anytime you need assistance with an All Savers client, right, or something on a standalone basis, or you just